Okay. Hi, everyone. Good morning and good evening and good afternoon. Welcome to the Gender and Platform, Gender and Plant Health online seminar series. This is the fifth seminar, and today's topic is Plant Village app, which have many functions to identify pests and diseases for many crops. And we want to understand how women and men farmers leverage knowledge from those apps, because we know that they are using, but we don't know how they are using and how much their crop are improving, and which crops they are using, and if men and women are using in the same way or not. So we had many questions. So this is a kind of follow-up research after training provided by Plant Village. So Faith and Meshach and Tracy are here. So please start, Faith, from, you can start introducing yourself first.
Okay. Thank you, Nozomi, and hi, everyone. I hope you can hear me well.
Yes.
I'm Faith Aroni from Plant Village, based in Kenya, in Eldoret. I am a gender specialist in Kenya, in Plant Village, Kenya, and I have my team. I have Tracy, who is a research associate lead, who is so resourceful when it comes to research. I have Meshach, who also has been responding to a segment on other crop section. So very beneficial when it comes to this study. So we did a study on understanding how men and women farmers leverage the knowledge gained from Plant Village app in regards to improving the diseases and pests in Kenya. So I'll take you through what we found out, and then you can ask questions. I think Nozomi will guide on that area, but we have Tracy and Meshach who will also be helpful in regards to responding to the questions asked. So let's kick it off. So we all know of how pests have been emerging and diseases in different regions and different areas with regards to agricultural and food productions. And we know how that has really been a menace when it comes to food security. So we have a tool like Plant Village app that is very helpful in regards to helping small-scale farmers, and not only small-scale, but also large-scale farmers in regards to giving them real-time diagnosis of crop diseases and best way to manage the crop diseases. So the app acts by detecting the foliar symptoms in crops by allowing the users to just simply take a photo or scan the affected leaves of the plant or the crop, and then it gives a diagnosis and a management of how to manage the crop. Now, the app has a number of AIs, cassava being the first one, because cassava was the first crop to be tested in Kenya in Busia County, and that was the first AI, followed by maize. And that's why when we go down to deep into the study, you'll realize that that was the most used AI, that is cassava and the maize. But now we have others like sweet potatoes, we have coffee, we have wheat, and the rest. So crops that do not have the main AIs are considered as other crop sections on the app, which now refers to a human expert, one of them being Tracy and Meshach. And that's why I say they're very resourceful in this specific study, because now they respond to the questions from different regions, Malawi, Mozambique, everywhere you are, as long as you're using the app and you got the crop sections, the other crop sections, Tracy and Meshach will help you respond to the questions asked and give you the best advice based on the how the crop is infected. So we had our objectives, and one of them was understanding how the app, Plant Village app, contributed to the level of confidence in regards to knowledge when it comes to pest and disease management between the male farmer and the female farmers. Two, we had an objective on understanding how far the app has contributed in improving in improving crop management between men and female. And if it has not contributed, what are the challenges you experienced that didn't make you the app being give you a contribution to it? Then we have third, understanding the gender-based challenges in access to information and benefit from the app, as well as the in-person extension services. So when we're looking at the analysis of it, we focus mainly on the different answers when we are talking of men, because we had men and women participate in this study. So when you're looking at the gender analysis, you want to see how many men responded to a specific aspect, either in a crop or the frequency of the using the app. So every answer or every respondent was based on how many men, how out of the men participated or out of the women who participated in the study. So we look at the study design and the population. The study of employed, or we used a cross-sectional cohort study, and we conducted it in 8 counties, which these counties are counties that Plant Village is currently on the ground. Now, these are just the few counties we have, but Plant Village is in, I can say, 3/4 of Kenya, because aside from Nairobi, Mombasa, all those counties that crop crops, we are in there. Busia, Bungoma, Kilifi, all those counties we are there. So we just focus on a few counties where we are actively having projects, because then that means farmers are using the app the most. So we have Machakos, we have Kisii, we have Bungoma, we have Busia, we have Makueni, Kilifi, Migori, and Baringo. So those are the counties we did the studies from, which are 8. Now, when we are looking at the study, we always have a model when we use in Plant Village when it comes to reaching out to or connecting to the farmers. And we always say farmers are our bosses. So we have lead farmer, following farmer, and extension officer, who is a Plant Village officer. So these 3 people, or these 3 models, are kind of intertwined. A lead farmer can reach out to an extension officer, who is a Plant Village officer, same as the following farmer. So when we want to go to a certain region, let's say, for example, Machakos in a certain sub-county, we will contact the lead farmer. Then the lead farmer will give us farmers who are kind of below her. So it's kind of an umbrella. So a lead farmer has farmers below her. It can be 100 farmers or 50 farmers below one lead farmer. So that is how we reach out to our farmers. So just a study area kind of in a map in regards to like the whole Kenya. We did the coastal region, a bit of the eastern, or that is Makueni and Machakos. Then we have Kisii, Migori. We have the western side, Busia and Bungoma, and then we have Baringo, which is closer to the Asal area, which is in the northern side, because we just have Turkana and Samburu and Marsabit just above there. So when you are selecting the farmer, the sampling technique that we used was the snowballing. So where we selected 4 farmers in each county, and then now those 4 farmers, 2 men and women, will now bring us farmers below them, which we call them now the following farmers. So most of the case, these 4 farmers were our lead farmers. Now they'll provide for us the other farmers below them, or kind of the farmers who reach out to her or him in that specific region. So we interviewed each lead farmer, and each lead farmer was to give us at least 4 farmers, men and women. But then you realize that when you go down to it, you realize that we had 63% women, which is higher than the men, because there are around 629 women who participated in the study. So when you look at it, when we were doing the follow-up into groups and asking farmers to give us following farmers, you realize that there are many, because when you get to the ground and you check, a group has women, like 90% are women, but maybe just 2 or 3 are men, or 10% are men, because to them it's like that is how they're balancing. They don't know about the 50-50. As long as there is a man in it, has a voice to give in that group, then they consider that as a gender balance. So we find that most farmers were female, because of most of their groups are female. Most of the farmers group had a lot of female farmers. So let's get into the results and the discussions of the whole study. So we had a total sample size of 1,000 farmers, and 629 were female, 371 were male, which equates to 63% and 37%. Majority of the participants were between the age of 18 and 35. Now, I might not have captured this in the study, but in counties like Kisii, Machakos, and Makueni, we really had young people who are part of the farmers, because when you look at Makueni and Machakos, they mainly plant citrus, and you see a lot of young people who are planting the same citrus for sale. So we had a big number on youths in those 3 regions that I've mentioned. So okay, of course, female represented majority, as I've explained before, and then majority of the people or majority of the farmers participants came from Kisii, Bungoma, and Machakos. Looking at these counties, we have Kisii and Machakos, which is one of the main counties that we are actively in currently. And we have Plant Village Plus agents who are working with farmers on a daily basis to just help them with whatever need they need in regards to extension officers, extension services, as well as also provide or sell inputs when farmers need, such as seedlings, biochar fertilizer, and also the hermetic bags that we are selling. So the Plant Village agents really helped us in regards to reaching out to farmers, and that's why you see Machakos and Bungoma having the highest number of farmer participants. Farming practices, we have the crops grown, the primary decision makers on those crops grown, and then we have ownership of smartphone used to access the PV app. So main crop grown, when you look at this, is you find maize is the main crop, because of course in Kenya we have maize as a staple food. So majority of the farmers that we reached out to are planting maize. Then we have also cassava. Cassava also is one of the farmers call it, sometimes it's more when there is no maize, we can use cassava. You can use cassava for breakfast, for lunch, and also as ugali or as a main meal. Then we have beans, because beans again is one of the major grown, because when farmers plant maize, they always do crop rotation by rotation by putting beans under to cover the to keep it moist down there. So you find them planting beans, or sometimes they do cowpeas or peas. So we have fruits. Fruits also came as a majority of the crops grown. And these again, I'll take it back to Highline, Machakos, and Makueni, because of they plant citrus and also they do mangoes. Then vegetables, bananas, and sweet potatoes. Sugarcane is not mainly grown as a food, but when in areas like Migori, you find them grow them for large scale, that is for selling them. So you find it has also been given around 12% and 21% of maize grown. So looking at the ownership of smartphones used for the PV app, we have one we had on whose phone do you use? Did you borrow someone? Was it your own phone? Was it a family member, or was it a spouse? Now, on borrowing someone, it could be a lead farmer has visited a following farmer who has a small phone. A small phone that does not have internet connection. So when they come to your farm, some following farmers are always curious, and they ask, "Can I have your phone to just survey my farm and see how it is?" So with the guidance of the lead farmer, they go with the following farmer to the farm, and then they use the app. So you find that majority of the female farmers saying that they borrowed the phone from the lead farmers, or from the following farmers. And then we have like 58 overall out of 1,000. And then we have 393, which is equivalent to 62% of 629 farmers borrowed the phones from a lead farmer, or maybe sometimes an extension officer. Then we have 51% of male borrowed out of the 371 also borrowed their phones. Now, farmers who use their own phones, sometimes it's their own personal phone, or Plant Village has provided them the phone to use on their daily basis, as well as do surveys on the farm. So you find that we had 28% of female respondents saying that they use their own farm, and their own phones, and 39% of male respondents say they use their own phone. Now you can already see a different gender difference in regards to the ownership of the phone, meaning men have, out of the 1,000 participants that we reached out, men had a higher percentage. Then we had family members. So family members encompasses your cousin, your sibling, your niece, your nephew, that you use the phone to survey the farm. And that was already giving like 5.7 female participants who say they borrowed from their family, they use their family members' phone to use on the PV app. And then we have 8.1% say of the male respondents say they borrowed from their family, they use from their family members the phone. Another tricky one is we have the spouse. Now, most people say, of course, the spouse, it could be sometimes, most cases, it has been the man has the smartphone. When you move to that household, when you get to that household, you find that the man has the smartphone. Now, 3.3% of females said they use their spouse's phone. And 1.9% of male respondents said they use their spouse's phone on the app. So using a family member's phone and a smartphone was among the not so common because, of course, we all know what a phone is and it's a personal item to use. So there are issues of maybe someone has some privacy or wants some privacy and doesn't want to give their phone to other people or to other, specifically to their spouses, could be male or female. So that just tells us that we need to look for another option that we can make sure that all the male and the female spouses in this space can have their own smartphone or have a smartphone that they are comfortable sharing. If it could be a group farmer's smartphone, or maybe in a group of female, we have a smartphone that every farmer can easily use to scan the crops as compared to them relying on their husbands or on their spouses. So we look at the general use of the PV app, that is in regards to phone signal capacity, who introduced you to the PV app, duration of the app used, duration of use of the PV app, frequency of the app use and function use, and ease or the accuracy of the app. Now, earlier on, I was mentioning about the main AIs we have. So we have the follow me one, which is the maize, cassava AI, we have potato AI, sweet potato AI, potato, this is the Irish. We have wheat, we have coffee AI, we have banana AI. Now, these are the main AIs. But then when you get to the other crop sections, this is now when you get to ask questions. Either it could be on a sunflower, it could be on a sesame, it could be on a fruit. So when you get to the other crop section, then the human expert will respond to the questions you have. But the rest are majorly on AI. So you get your responses there and there. Looking at the phone capacity, again, we had 1,000 respondents on them on the specific question on does your phone capacity stroke signal affect your ability to use the PV app in the field? 505 out of 629 females said no. 289 out of 371 said no. That brings 82% to 79% female to male. Those who said yes are 21%, that is out of 1,000. We have 124 female respondents said no, yes. We have 82 male respondents said no, yes, sorry. So that brings us 20 to 22%. Then on the question on does your phone capacity affect the ability to use the PV app in the field? We have a total of 91 out of the 1,000 said no, and we have 91% out of the 1,000%, out of the 1,000 participants said no. We have 9.5 out of the 1,000 participants said yes. Looking at the gender side of it, we have 91%, which is equivalent to 575 females said no, and 330.
Perhaps you have a lot of slides, so you can maybe summarize for the message, the figures, they can see it. Yeah.
Okay. So looking at the phone capacity, most farmers said the phone capacity stroke strength did not hinder their use on the app, while slightly a higher percent of male reported that the issues of phone signal stroke capacity affected their ability to use the app. Now, when you look at the PV app, it does not really require a lot of data when it comes to downloading stroke using. And we also have an offline mode where you can just scan the crops when in the field. Then when you get data later on, you can use the data to upload to the human expert, and then you get the response. So looking at the introduction of the PV app stroke frequency and duration, we have half of the respondents said they were introduced to the PV app by the Plant Village agents. Now, the Plant Village agents is a new model that we are having right now at the moment, where they're the ones in contact with the farmers at the moment. So you get that gave a higher number of people who are introduced with the app. Now, this again goes to specific counties. We have Bungoma, Machakos, Kisii, and Makueni. Then few female stroke male farmers introduced by the family members. Now, this is when you find we have a lead farmer, but in that household, she has 2 kids who are over 18, and then now they can use the app, or they're curious to use the app. So majority of the farmers have used the app between a period of 3 months or so, because it was, again, we're just finishing off the season of planting, so it was a harvest period. So you find that most of them are using it in 3 months because of checking and monitoring their crops as they grow. Okay, so looking at the PV app functions, we have Cassava AI leading, because again, as I mentioned earlier, that is the AI that was first developed, followed by the Folamium, which is on maize. And then we have on the other crop sections that was also leading. We have the ease of use and accuracy of the PV app. We had a percentage of 68% who reported that the app of male reported that the app was very easy to use, as compared to 59% of female who said the app was very easy to use. We have 75 women stroke 65 men reported that the information they received from the diagnosis of the app was accurate. Looking at 68% male said the app was easy to use, and 58% said, or female said, the app was very easy to use. That already tells you that we need to orient or sensitize the female farmers more to use on the easiness, or tell them how to use the app or the functionality, so that they can also have a good number of them saying it's very easy to use, because 68 compared to men, that is lower. So looking at the impact of PV app and farmers' response, impact of the app on crop diagnosis, the actions taken by farmers, which was one of the key items in this study, because we wanted to know, fine, you took the advice from the app, was it beneficial to you? Did you understand? Were there reasons that you didn't implement the advice? So looking at that, we have most male and female farmers reported that the app has helped them identify crop diseases that they were not familiar with. The app has also helped them identify diseases that previously they were not aware of because of various reasons. Maybe they didn't know, some of them know the crop diseases in their local language, or in some language or some name, but then they didn't know it in English or Swahili. So the app has really informed them in regards to knowing the particular crop, this is how bad it can go and how to manage it. Then we have 80% of female stroke and 80% of female and 86% of male did take the actions from the app. That already tells you that the app is very, very beneficial, because the higher percentages we have both from the female and from the male. Then looking at the actions taken, we have out of the 824 farmers who say they take action from the app, we have 80% female and 80% female who implemented. Now, looking at the highest advice that they took was use of fertilizers on their crops, which is bringing 99% of women and 100% of men. Now, this is good, because that specific advice of use of fertilizer fertilizer is always readily available. It could be the compost manure, it could be the synthetic fertilizer. And when they respond to you to use on the app, they tell you to use on fertilizer, they give you both options. They tell you can use the compost manure, or you can also use the synthetic manure, so it's fertilizer. So it's upon you to choose which one is available for you. But 99% of women using that fertilizer, that is very good to us. Almost half of the farmers either uprooted or robbed out their crops from the advice. Now, when I mention uprooting or rogging out, someone will be like, oh, Faith, that is like we're losing crops. But no, we have a crop like cassava, which does not have cure. So the only best way is to rog it out if it's diseased and plant a clean cassava, or take it out, bury it or burn, and then plant a whole clean cassava, or do crop rotation, change the place you planted cassava and take it to a different site. Then we have implementation of biological control stroke integrated pest management was very, very low as compared to fertilizer use and pesticides. This specifically finding really gives us for me, it gives me a question of we really need to find out why that was implementation of biological control was very, very low as compared to use of fertilizers and pesticides applications for both men and women, because I need to understand why. That is a good question for future study. So we have reasons for not taking the advice. We had females saying lack of finances. We had others saying healthy plants, stroke clean farms. Sometimes when you tell a farmer you need to rog out your cassava and plant a healthy cassava, they tell you no, even that small disease that I'll find food in it. So you hear them say the reasons why they did not take the advice is because of the healthy plant. Some say they did not understand the advice, and then this tells me that we need to help them understand by providing extension officers or PV plus agents who will be there to help them understand why they need to take the action, or why they need to take the advice from the app, and how best can they implement the advice. Because some of them are using the app, but yes, they didn't maybe go to school, or they went to school long ago, and now the kind of the knowledge is not so high as it was. So they need an officer to kind of elaborate the advice to them. Sometimes we advise on using of sulfur, sulfur component pesticide. They need to know how to get those components off and where to check the components. So not a decision maker ranked the third for women, indicating the training is required for both the husband and wife. Now, we need to train both men and women in that household or in those households for them to know that even when the man is not there, the woman can step in and make a decision. Or when we're deciding about an implementation of an advice from the app, the woman has a say on it, the man has a say on it, but the man has a say on it. And that can only happen once we train both of them. We can choose to train the woman, yes, but then when they get to the home, she will not have a say on implementing that advice. But when you bring both of them to a training and train them, then that would be a perfect way of making sure that both men and women are participating in decision making. Looking at improvement on crop production and confidence level, this is a good question, mostly on the confidence level, because we wanted to know, okay, fine, you've used the app for maybe 3 or 2 years. Has it improved your confidence? Can you now tell me this is cassava mosaic disease, this is cassava brown streak disease, without even using the app when you look at the symptoms? Because then that means you familiarize yourself so much from the app and those crop diseases. So we have 78% of women and 81% of men experience improvement in their crop production. And prior to the app, less than 5% of farmers, that is 1.2% of women and 2.5% of men, are very confident. That is prior to the app. And now they have the ability, they have the confidence and the ability to do crop diagnosis without using the app. Some of them just use the app to confirm, is it what I have is what the app has, which is very good when you see them in the field. And sometimes we go to the field and they're the ones now teaching us on how best we can do crop diagnosis. Looking at the improvement in farming following use of the app, we have 493 women and 301 men reported improvement following the advice from the app, which is a good, perfect way, because the range is not so good. And I can see women are leading in it, which is perfectly fine, because then that means they have that empowerment in regards to, I can use the app to do crop diagnosis and I'll have improvement on it. Then looking at the better yields, better crop yields, which was top the rank, because you've used the app for a couple of times, you've seen improvements. So what next? You just have good production, which is very fine. And we see 25% of women reporting that they had better yields in their farm, and 19% of men reporting they had experienced reduction in pest diseases, which now brings, when the moment you have reduction in pest and disease management, that means your farm is healthy and you'll have good yields. So we also looked at other sources where farmers get information other than using the PV app. We have those who say they have plant village officer. And as I mentioned earlier, plant village officer is the daily work is to visit farmers and help them whenever they need any help. So say some majority of them said plant village officers in person on the ground, visit them frequently and provide information to them, which is bringing a percentage of 48% of women and 58% of men. Some said fellow farmers provide information. Some said that is for women, fellow farmers. Now, when I see women saying fellow farmers provided information for them, then that tells me when they go meet in their chama or in their groups, they can easily discuss. Or when a farmer feels that there is a problem in her farm, she can confidently seek help from a fellow female farmer, which is very good because then that means she tells you there is someone else who has more knowledge than her that she can seek who is of her gender. That is empowerment. For men said agricultural extension officers helped them in regards to getting other informations, which was top second. Now, this tells you we have no men saying they went to their fellow men to seek information. We have them saying they went to someone they feel has the background in agricultural extension officer, who is an officer. But we don't see them saying, I visited a fellow man and seeked knowledge. Then we have women had fewer access to online information compared to men. This again goes back to the ownership of smartphones and also network connectivity. Now we have in a household, maybe you can find a man has the smartphone and then you have now to sit there and wait for him to use, or when he steps out, that is when the woman can now have access to the online information. Looking at those who say they are not satisfied who they consulted and when they are not satisfied with the PV app, again, consultation was highly made to the plant village officer because these are people who trained the lead farmers in the first place. These are people who visit farmers on daily basis. So a farmer will feel very confident visiting a plant village officer as compared to maybe just ignoring the diagnosis of someone. So we have 72% women, 76% men consulted PV officer when they were unsatisfied with the PV app advice. Sometimes you have the app and it brings you a lot of, mostly when using it brings you a lot of information, and now you need to understand, is whatever I have same as what the app is giving me? So you kind of feel like, no, the app has not given me much. And then now you call in the officer to come and help you. In this case, both of them will go to the field and use the same app. Then now the PV officer will help explain more, elaborate more to the farmer. So we have training of agricultural extension officers is provided for follow-up support. They need much of support because these are people who we say they live with farm on daily basis. They wake up, it's the farmers calling them to go to their farm. So they need more training about it. Then last or not least, we looked at the socioeconomic and the cultural aspect of it, looking at the access to agricultural technologies like PV app, the barriers, challenges they face when using agricultural technology, and of course, societal norms that affect men and women when they interact with agricultural tech. Looking at this, we have overall, most farmers have access to agricultural technologies and majority have participated in training because before we give you the phone, we have to train you first. Train you, make sure that you understand how to do the surveys, then now you can have the phone. Aside from that, when we're having farmers who are able, they have the capabilities of downloading the app themselves on their own smartphone, still they have to go through a training by a field officer, plant village field officer, to help them know how the app works, the functionalities and how to use it. So we have most of them saying they have participated in trainings and of course have access to agricultural technology. While there was a slight difference between the male and female in terms of training participation, the men were slightly more higher than to participate than women, and of course with reasons being you find that most training are in the morning. That morning the same woman has to go to the farm. That morning the same woman has to go to the training, at the same time has to leave very early to come and prepare food for the kids who are coming from school. So there's that a bit of interaction. So then that means we have to make sure we have a good time allocation for training, farmers so that we can have all of them concentrating in one place, even if it's a short period of time, but having a very, very comprehensive training so that all of them can participate and concentrate in that training. That will be perfect. Then we have challenges faced that will hinder them from using the technology, agricultural technology. We have a lack of smartphone, which was a majority, as we had initially seen, majority of them were saying they were borrowing phones from their lead farmers to use the app. So we had most farmers, that is 71% women and 74% men, reported lack of smartphone as a hindrance to accessing agricultural technology. And then the overall majority, the majority of the challenges were revolving around digital infrastructure and the cost of using it for both men and women. Because we have issues of limited access to technology, we have issues of limited access to training and digital literacy. So those are among the challenges that were highly experienced by farmers. So we look at the societal norms, societal gender norms influencing use of influencing agricultural production. We have women have much higher recognition in barriers they face in agricultural production based on their gender and social norms. Decision making and access to resources and knowledge are interlinked with the social and gender norms. And one of the norms, one of the gender norms or societal norms that I came out that was very funny to me when during the field visit was when a farmer tells you, I, the mother, has to do the farming first before my girl or my daughter-in-law does farming. So I have to be the first to prepare the farm, and then now my daughter-in-law will follow. So I questioned and I was like, okay, what if you do not have the capacity or the ability to prepare the farm? Does it mean that your daughter-in-law will sit and wait until when you have the capacity? And the answer was yes. So you can tell how much of societal norm influence how we use agricultural technologies. Then we have user experience stroke recommendation of the app. So the likelihood to recommend the app, the missing features on the app is what I'm going to cover next. So we have we had only 3 people who said they will not recommend the app, and 987 farmers say they will recommend the app to other people. Those who say they will not recommend the app, their responses was they need to be trained on how to use the app before they recommend the app. They just want to be them because he or she feels like she's learned, and then she wants to be just the only one in that area. So these 3 answers were responded by a woman, all of them. She wants to be alone to be the one to use the app. She's just okay because she's learned, and then she wants more training to use the app. Hopefully when we give her more training, she'll be able to train the rest now. Looking at the missing features, according to how farmers recommended, majority said none. Majority said the app is perfect. That is 37% of farmers reported the PV app does not lack any feature, and 28% of out of 1,000 farmers say they would like to have the livestock module as a main feature in the PV app. Others say soil testing, marketing, the offline mode, and the rest. So use of the app, other than the PV app, we have only 19 farmers have participated in using another app, a mobile app, in regards to diagnosing plant diseases. And some of those apps were Plantix, which was also an app that was used. The other one was Equator, the other one was Yara, the other one was Eprod and Digifarm. These are apps that farmers use in regards to diagnosing the crop diseases. Okay, so coming to my conclusion, the study highlights the effectiveness of PV app in improving farmers' knowledge and practices in regards to pest and disease management, which contributes to improved yields and better disease diagnosis across various counties in Kenya. Despite gender disparities in smartphone ownership, both men and women found the app very beneficial, with majority of them reporting increased confidence level in handling crop diseases, indicating that we target women and improve appropriate in-person training and follow-up support. Women can equally benefit from the app. However, the challenges such as lack of access to smartphone and internet connectivity persist, limiting its full potential of using the app. And that's why when initially I recommended that our offline mode should be expanded so that we can be able to give farmers all they need. Sharing smartphone and information within the household did not take place, but and we need to train both husband and wife on the importance of doing so. Implementing the advice provided by the app remains challenge, basically, especially for biocontrol and integrated pests for both men and women. So we have recommendation, and from the study, we recommended both the extension services and the PV app developers. For the extension service, we'll recommend to facilitate training for farmers, especially women, on PV app usage and digital literacy to address the knowledge gap they have in regards to using the app, providing more smartphones to farmer groups, ensuring equitable access to Plant Village app use, and also that will, if you're providing farmers with phones in their region, that can easily lead to empowerment in regards to knowledge because they can easily share and exchange information gained from the app. Then we have strengthened on-ground support via Plant Village officer to provide technical assistance and encourage more farmers to take action based on the PV app. Yeah, these officers really do much on the field, so we need to fully support them in the best way we can, so that they can also help farmers. We have engaged the government to provide subsidies to enable men and women farmers take actions based on the recommendation provided by the app. Mostly when you see majority of them did not use the biocontrol because the reason was lack of finances. So when the government does this, then we are sure the farmers are going to use the advice from the app. Then recommendation to the developers of the app, we have to expand the offline functionalities to make the app more accessible in areas with poor connectivity. We have areas that do not even have power, so we need the offline mode so that the farmers can also benefit from the app. Then introduce the livestock management module and other key features such as soil testing on the app so that we can have a whole package in regards to both livestock farming and also crop farming. And lastly, enhance app performance due to latency issues reported by some farmers. That is it for my presentation, and this is us ending the whole research. Thank you so much for participating, and I want to give an acknowledgement to the CGIAR Plant Health Initiative, which is being led by Nozomi. Thank you so much for giving us the funding to run this study. We really appreciate, and that was of much help. So thank you so much. I will allow questions which will be guided by Nozomi, and we have Tracy and Meshach who will help me respond to the questions. Thank you so much.